Hello, this is a Meuse Rhine Journal webcast on health care and cure. We're going to speak to Guus Broos of Orbis, but first we're going to speak to Guy Peters, the CEO of Maastricht University Hospital, one of the three major healthcare centers in this part of the world.
We are going from treatment from symptomatic disease to more predict and prevent disease, and that's one thing. The second thing is that we have now in most countries a government healthcare controlled system. But in the future it will be much more market, so that the patient chooses his own provider for healthcare. So that are the big drivers in change at the moment.
Prevention is now, especially in the future, very, very important for everyone who lives in this country. And therefore we are changing our hospitals not only to have a reparation hospital, but more activities to make prevention programs for people.
We have to define what change we want to invest in. And that are always the change, of course, in which we are doing a lot of research now already. So what we want to do, in fact, is to get the research and the outcome of research much more faster to the patient as we do now. And that's why we need this change, and we need also the help of industry, because industry has a lot of questions they can ask us, and we can do the research, partly can do the research for them.
The Limburg Health Valley is probably the challenge for the future, because we have here a lot of healthcare and very important healthcare. I'm thinking to the university, the medical school of the university, the medical top clinics of this province, and especially in the south of this province, and we have to maintain them. That is the point.
I must say we're going to build new buildings. Especially for students, but also for the laboratory facilities in which we can work together very close with this industry. So, and why is this necessary? Because we want to know what they want to have, and that's for us a new input for new research.
It is a part of the social economic agenda. It is not only what we call the cost, and you have to reduce the cost. No, it is an industry, kind of industry that we can export, that we can expand, and we have also to maintain it in this area.
We are working now in the healthcare with, let's say in South Limburg, with 3 big hospitals. In the future, I think it will still be 3 big hospitals, but we will not do everything what we are doing now at the moment. I think the academic hospital will especially do more the technical, super specialized things, and the other hospitals will work together much more in the field, let's say for more general medicine. But we also, as an academic hospital, will have a few functions also in Heerlen and in Sittard. So there will be a more like a network academic hospital, but also more working together between the general hospitals themselves.
We can use better the center of the Tripole, the center of the heart of South Limburg, for the center of prevention, and the intervention centers to maintain in Maastricht, in Heerlen and in Sittard. That is also a part of what we called the agenda of the future.
Guus Broos of Orbis talking about top care. And now we are at Chateau St. Geerlach in the heart of South Limburg's beautiful hill country, which is where you can enjoy top care. In a superbly restored convent and stately home with all the accoutrements, and slap bang in the middle of a nature reserve. And that is our webcast on healthcare and cure from the Meuse Rhine Journal.